On that, the Hackensack Meridian Health was among the first U.S. hospitals to administer the COVID-19 vaccination in New Jersey. Doctors at the hospital are calling this a beginning of the end of this nightmare of a pandemic, and Dr. Lisa Tang from the Hackensack Meridian Health was among the first of a network of roughly 36,000 team members and physicians to receive the first dose of the highly anticipated vaccine before a live audience. The hospital CEO, Robert Garrett, called it a truly remarkable day, saying that they were so honored to make history as one of the first vaccination sites in the entire nation. Held at the Hackensack University Medical Center, here is the story on the first inoculations of the very first COVID-19 vaccine.
This is, in my opinion, truly the beginning of the end of this nightmare of the COVID-19 pandemic. It's the good news that the entire world has been waiting for and needs right now. And Hackensack Meridian Health is so honored to be making history as one of the first vaccination sites in the entire nation. First, I want to recognize and thank our healthcare heroes who have battled this pandemic for nearly a year. Their extraordinary skills and compassion were put to the test like never before. And I'm humbled by their courage and by their resilience. When the books are written about this relentless pandemic, they will be remembered as true American heroes. Let's give them a round of applause.
You know, it's a very, very important thing that our healthcare workers are the first to go through the vaccination process for two big reasons. The first is these folks have been living in the middle of this war. We always said that one of the greatest risks of the COVID-19 pandemic was the overwhelming of the healthcare system. And this team has seen it. They've bent, never broken. They've rebounded and have had to bend again with this second wave. So getting them protected is the smartest, best act of grace that this country could ever do. The second reason it's really critical is that for folks who've been living this every day, like these folks, to roll up their sleeve and stick out their arm and said, give me this vaccine, is an example to the rest of the country to let everybody know that this is safe. We believe in it. We trust it. We're going to do it. We're going to recommend it to our family, and we're going to make this happen.
The best team that I was on understood that we had to put our differences aside. We had to become a team and be focused on that one key mission, that one key mission, and that is do the best that you can do and be the best that you can be for your teammate and for the team. With this, everybody is on the same team. It doesn't matter where you're from, how much you make, what your religion is, what your political position is. Everybody is on the same team. And I would just strongly encourage, again, especially those in the African-American community, those who look like me, to not be afraid, but to step forward and do it, if not for yourself, for others in your home, in your community.
So this is a historic moment. I'm grateful to our team members who have continued to provide patient-centric care during COVID. This journey continues for us since March, even before the first patient walked into the doors. The team was prepared, the team was ready, and committed to providing the best care possible to our community. And they have my eternal gratitude for that. I'm humbled and privileged to be representing the HUMC team. But I'm also very cognizant of the lives that have been lost and impacted by COVID. It has touched our hearts, and it has totally changed the world we live in. The vaccine is a triumph over the fight against COVID. I have trust and faith in the science behind it. That is the reason I will be taking the vaccine today. HUMC has treated multiple COVID patients, And I'm proud to say we have discharged more than 2,000 patients to their homes, to their families, and restoring their quality of life. Today is my way of paying it forward to ensure immunity and safety for our community, for my peers, and all the loved ones that you have back home. Please, physically distance, wear your mask, wash those hands, and get vaccinated when it is ready and available. This is my ask, and I think it is an important step that we take towards ensuring that we continue to live healthy lives in the future. Thank you so much.
Okay, Dr. Joe Underwood, who is the chairman of our emergency department at Hackensack University Medical Center, will be vaccinating Dr. Tank at this time.
Ready for this? Yeah, ready. That was good, Joe. Can you feel it?
Let's give Lisa a round of applause. Okay, first question. How you feeling?
I'm feeling great.
Okay.
And to
Everybody heard
Dr.
that?
Underwood, thank
She's
you.
feeling great. Thank you, Dr. Underwood, for that as well.
As we looked at putting together the cohorts of people who would get vaccinated, the first thing that we realized is that, as Bob said, the difference between the very first people and the last of the patient-facing team members is a couple weeks. So we're not talking about a really big difference. And so we're confident that we're going to get our team members vaccinated and folks are going to be safe. We really looked at this predominantly, first of all, taking the 36,000 HMH team members and dividing them into people who were patient-facing and people who were not. And then within the patient-facing cohorts, we actually look at their risk of exposure to COVID. So those folks who are taking care of patients in COVID units, our doctors in the emergency department, our nurses and doctors in L&D, which are kind of the high exposure areas. And so we start with them, but we're going to have enough vaccine to cascade through that whole workforce in about 2 or 3 weeks.